So artificial sweetening agents are very important when it comes to diabetic patients. So diabetic patients are not supposed to take sugar. Sugar is going to give calories which are not required by the diabetic patient. Then what to take? They want to eat some sweet things. Then they can take this saccharin. Saccharin is an age-old compound which before the identification of the chemical structure, it has been in use in most of the countries, even in India also. So saccharin is mishri. Yes, it is even till date also in temples as prasadam. They give some prasad. So mishri you can take, and this mishri, this saccharin is going to be excreted in urine unchanged. Means this sulfonamide, it is saccharin is going to be orthosulfobenzyamide. Orthosulfobenzyamide is not going to be destructed in our body. It is stable. It is not going to be destructed by any enzymes, any chemical in our body, and it is straight away, it is excreted in urine without change. So it is harmless when taken. Yes, harmless, but what is the use? It is going to give 550 times sweeter than sugar. Means if a teapot is going to be added 550 grams of sugar to make it as tea, instead of that, if I use only 550 mg, it makes sweet. So 550 times sweeter than sugar. So this is how it can be used. But what is the use? It is not going to give any energy. It is not going to be utilized in our body. Yes, if required you can take it, but there must be some purpose when you are giving to the patient. So what is the purpose? Then comes aspartame. Aspartame is amino acid. Amino acid, see, this is aspartic acid part we have learned during amino acids, and this is phenylalanine, methyl ester part. So this is amine and amino acid peptide. It is a natural product. It is not going to cause any problem. It is not going to have any glucose molecule in this. Yes, patient can take easily, isn't it? So diabetic patient can take easily, and this sweetness is 100 times better than sugar, sweeter than sugar. So this aspartame is used in cold foods. So ice creams or some soft drinks are going to be used these aspartame. But the problem of using this aspartame is when you use in cooking, if you add this aspartame while cooking your food, at that temperature it goes and breaks at here, isn't it? Amide bond breaks, this amino acid and this amino acid, and sometimes it breaks at different places, is going to become as a poison, or it is not going to be sweet. It is not going to act as sweet. Then other sweetener came into the picture. That other one is Alitame. Alitame is going to be having the same aspartic acid this side, up to here aspartic acid, and this phenylalanine part is different, and it is highly sweeter, 2000 times sweeter than normal sugar, table sugar, sucrose, right? So sucrose is sugar, so 2000 times sweeter. Means when some sweet requires 2 kgs of sugar, if you want to make a sweet, that sweet requires 2 kgs of sugar to be tasty, you can use only 1 gram of this alitame is sufficient to make this much sweet as sweet. Yes, but and it can withstand at high temperature. You can use it in sweets, but the problem is it is very difficult to control the sweetness. Means, so your mind will teach you that use 2 kgs of sugar. So instead of using that 2 kgs of sugar, if I say use only 1 gram, no, you may not agree. You will go and add some, at least some spoon or some 2-3 spoons. That makes the sweet more sweeter. So the control of sweetness is very difficult using this alitame. Then next comes sucralose. Sucralose is very important synthetic sweetening agent, artificial sweetening agent. It is very similar in look and taste is with respect to sucralose. Sucrose, that is sugar, common sugar, and it is 600 times. So instead of using 600 grams, you can use 1 gram sucralose, and it is a trichloro derivative of sucrose. It is can be prepared in lab, and this sucralose is going to withstand at high temperatures also. So all these are not going to give calories. So these are all can be taken up by sugar patients. Sugar patients happily they can take all these sugars. That is how these artificial sweetening agents, learning these artificial agents is very important when you are going to learn about diabetic mellitus. One more thing, yes, you can take proteins during diabetes. Anyhow, I am going to explain during the diabetes lecture. Right, artificial sweetening agents. Next, food preservatives. For example, pickles, jam, these burgers or breads. We do use foods for preservative purpose. Yes. So what are the common preservatives in your home? These jams and breads. Before coming of all these things, you have come across these pickles in your home. Also your mother used to use this table salt, sugar, vegetable oils to keep the foods for long days, for long periods, right? So table salt, sodium chloride can be used to preserve some food, pickles, right? Tamarind pickle can be kept for long times by using just table salt. Yes. So use sodium benzoate. It is also one of the chemical. Sodium benzoic acid, salt of sodium, can be used to keep the foods for long days. And sodium benzoate used in limited quantities and is metabolized in the body. Yes, you can use in a minute quantities where there is no poisonous action was found using this sodium benzoate. Sometimes you can use sorbic acid, sorbitol, sorbic acid, and propanoic acid. You can use propanoic acid. Like this, some acid salts can be used where these are not going to disturb your body functions, and this food is going to be preserved for long times. And antioxidants in food. Yes, antioxidants. For example, this is a curd. Nowadays we are getting curd in packets, and if you make in your home, it is going to be spoiled within 2 or 3 days. Over the night it goes and spoils, but in packet it is going to stay for even 10 days, long times also. It can be used for long days. What they are going to add? And beer, for example, wine and dry fruits. If you keep just dry some fruits and keep aside for few days, it allows some fungus to grow. But in market you are going to get all these dry fruits without any fungus. How? They are going to add some antioxidants to keep the food away from this oxidation. These are food additives which help in retarding the action of oxygen, and oxidation of food will be stopped by using these chemicals. What are the common? Butylated hydroxytoluene and butylated hydroxyanisole. BHT and BHA are commonly used compounds to avoid or to stop the oxidation of food. Addition of BHA to butter, just now what I said, increases its shelf life from months to years. So butter, see, and the BHT and BHA with citric acid, this is citric acid, yes, citric acid are added sometimes to produce more effect. Citric acid is edible, nothing will happen. And sometimes sulfur dioxide and sulfite are useful antioxidants for wine and beer. Sugar syrups, sometimes sugar syrups also. This sulfur dioxide can be used for sugar syrups and cut, peel or dried fruits and vegetables. So sulfur dioxide is going to be useful as food antioxidants in food. This is and bye. We will meet again with new topic. Till then, take care. Arigato gozaimasu. Bye. Thank you friends. Thank you all. Thank you for watching this video. Please subscribe my channel Venus Academy if you are not yet subscribed, and don't forget to click on like button and bell button. Bye.